Halo semuanya, saya Ira dari Lavender Medicare. Saat ini saya berada bersama Dr. Sam Eun Hoi dari Pan Asia Surgery. Dr. Sam adalah seorang senior urologist dari Mount Elizabeth Hospital di Singapura. Dr. Sam, can you tell us a little bit about yourself?
Okay, I'm a urologist. Been in private practice in Singapore for the last 16 years, with main interest in prostate, cancer of the urogenital system, as well as stones.
What do you like most about your job?
The fact that I can interact closely and hopefully do some good for my patients. It is very satisfying when the outcome is good. Patients walk away feeling better.
Why do you decide to decide urologist?
I started life as actually a cardiothoracic trainee. So I was training to be a cardiothoracic surgeon. I had a standing offer to do urology from my previous boss, so I went back and then he gave me a job as a urology trainee.
What is the most interesting case you ever encountered?
There are many interesting cases that we have encountered. Patients who presents with diagnosis that was very difficult to establish, but after working it through carefully, we diagnose tuberculosis of the prostate, which is actually extremely rare, and the patient has recovered very well.
Dr. Sam, I understand that prostate cancer is one of the top 3 cancers for men. Why is it so common?
Prostate cancer is common for a few reasons. One is, I think it is because we are now living the lifestyle of closer to the Western people. We eat a lot of food that contains animal fat, and that is one of the reasons why now we are seeing more cancers in the Asian population. Another reason is because since PSA has become available, a lot of screening has been going on.
So what are the symptoms that patients usually feel when they have prostate cancer?
Most of the patients, I would say 75 to 80% of the patients we see now do not have symptoms. They do not have any pain, they do not have any discomfort. Their cancer is actually detected when they go for health screening and they are found to have a high PSA. Prostate cancer and prostate enlargement, they are 2 different diseases, but interestingly, they can coexist together. Prostate enlargement tends to present with symptoms. They come with frequency of waking up at night to pass urine, they come with passing urine slow, they come with frequency of passing urine, so they come with symptoms. Prostate cancer, like I mentioned earlier, tends to be quiet and silent until late stages.
What are the treatment plans that you would offer to your patient when they come to you for prostate cancer?
For prostate enlargement, the treatment plan varies from not doing anything, just advising the patient how to drink water at the proper time of the day, avoid coffee and tea. Then you can escalate the treatment to using just herbal medicine, and then you can go on to real Western medicine to treat the prostate enlargement. And if that doesn't work, or if they have side effects, then you can go on to procedures that you can use to make the prostate smaller, like water therapy, water vapor therapy, called RISM, where we introduce steam into the prostate to make the prostate smaller. And then of course what I would call the gold standard, where you actually scrape out the prostate and create a channel. That is called a TURP. So this is for prostate enlargement. Prostate cancer approach is completely different. We suspect prostate cancer. Nowadays we do an MRI, and if it's confirmed a suspicious nodule, then we do a biopsy, and then based on the biopsy as well as the MRI findings, then we will, what we call, like all cancers, we will stage them, whether they are stage 1, stage 2, stage 3. And then the treatment for the stage 1s, usually you aim to cure them, either by robotic surgery or by radiotherapy, or in selected cases using focal therapy. Those with advanced stages, then actually the cornerstone of the treatment is actually hormonal therapy. That means they cannot be cured. You are just trying to control the cancer by treating them with hormonal therapy.
Is surgery always the only cure for prostate cancer?
Essentially, there are a few options. One is what you mentioned, surgery using the robot. It's called a robotic radical prostatectomy. Using radiotherapy to treat the prostate. Focal therapy, which is actually using a special type of high intensity ultrasound to focus on just where the cancer is and treat that area but spare the rest of the prostate. If we talk about robotic radical prostatectomy, the surgery, that for sure the patient will never ejaculate again. The patient has a chance of having erectile dysfunction, and there's a risk of incontinence, urine incontinence. These are the side effects of surgery.
Are there anything that men can do to maintain a healthy prostate?
Unless you can remain young and don't grow old, then you will have to deal with an enlarged prostate. There are a few things you can do. You can start on supplements earlier so that you slow down the growth of the prostate. Seek medical treatment, seek a specialist opinion when you think that you are having some symptoms with regard to prostate enlargement. After the age of 50, I think you should have a PSA done once a year. If there's a family history of prostate cancer, immediate male members of the family having prostate cancer, then you should actually do your PSA at the age of 45, earlier. And this is the way to keep yourself safe. If you have prostate cancer, it will likely to be an early prostate cancer that's detected on PSA, and like we discussed earlier, there's always the potential to cure the problem.
Terima kasih sudah menonton acara kami pada hari ini. Kalau teman-teman mempunyai masalah prostat dan mau berkonsultasi dengan Dr. Sam, bisa menghubungi kami di Lavender Medicare. Thank you, see you!